So we also have chemical preservatives class that can be added. Commonly, we have urboric acid. Okay, this prevents bacterial growth and metabolism, but it interferes with drug and hormone analysis. So wala ba ng problem? You cannot detect class for the concentration of your creatinine, urea, na kasi maka-affect siya class. Pero na siya yung advantage na prevent niya ang bacterial growth and metabolism. That's why this is the preservative class of choice if ang specimen maka-undergo of microbiological testing, GSCS, gramocin, culture, and sensitivity. Kasi prevent bacterial growth and metabolism. Ito na yung ginaan. Okay? Next, your formalin. So this is very excellent sediment preservative. Kaya excellent preservative man siya because it will present class the red blood cells, WBCs, proteins, and casts. That's why formalin is the preservative of choice if you're going to perform what type of testing? Ha? Unsa tong na-discover ni Thomas Addis? Addis count. So di ba, when you say Addis count, this is a quantitative counting class of the numbers of RBCs, WBCs, proteins, and casts. Since excellent siya sa sediment preservative, that's why it's the preservative of choice for Addis count. What's a specimen of choice used for Addis count? Urine, sir. Siyempre, urine. But what's the class? Specimen of choice? Ha? Trando, midstream, first morning, or postprandial? Ha? Okay, so specimen of choice is 12-hour urine. Okay, take note ha. 12-hour urine class ang ginagamit. Okay? What's the device? Kanina umino kayo nag-throw ng mga mas known na questions. What's the device used to count the number of red blood cells, WBCs, and casts? Since quantitative man siya na counting ang Addis count. Addis counter? You need to use Neubauer or hemocytometer. Tandaan na ha, Thomas Addis, saminaw. Thomas Addis, Addis count, sa gina-count, RBCs, WBCs, casts, and proteins. Kung saan na device ang ginagamit? Hemocytometer or Neubauer. Dapat kabalumaan na. Okay, so main disadvantage class of this one is that it acts as a reducing agent that interferes with the chemical test for glucose, blood, leukocyte esterase, and copper reduction test. So copper reduction test is always correlated class with your glucose. Kung sa mga copper reduction test class, muna sila mga tablet test. Okay, so when we say tablet test class, so this is a tablet, and this is added class of urine. Okay? So if national color change, ma-detect siya. And usually class, this tablet test, ginatawag din sila mga reducing test. Okay, and take note that we only have 3 tablet tests for urinalysis. We have our cleaning test, tablet test. We have your acid test, tablet test. Cleaning test, acid test, and ayaw ko sa isa. Cleaning test is for glucose. Marites. Nakalimutan ko sa isang class. Pag-search ko dara sa libro. Either bilirubin na siya or sa chemical parameter. Nakalimutan. Pinitest, acid test, so katigaw ka tulugan eh.
Paras ka na Aaron. Sabang pabalik ko na.
Ah?
Asa man po para with police? Parang hinders mo.
Pinahabang taon na ito. Ano no? Ketos, dili naman ako. Acid test, unit test, o
Sinite.
icto test.
Ito, I hear. Ito? I see.
Okay, so yung mga ito test, para saan siya? Pilirubin, maling ito. Ito.
Sir!
Confused ka rin dalawa kasi test is for... Ha? Pilirubin ang... Ito.
Aeroplane sir.
Kasi test, ito. So, mali sila po ang reducing text class. Okay, to detect reducing substances. Again ha, tablet test na sila class, tablet na sila na ginadrop sa urine, na detect color change at sa time na present ang reducing substances. Okay? Okay, next one, we have your sodium fluoride. So this is a very good preservative class for drug analysis. Okay, but it inhibits chemical tests for glucose, blood, and leukocyte esterase. Okay? Ang sodium fluoride, kung saan niya siya? Preservative or anticoagulant?
Preservative.
Preservative, anticoagulant.
Preservative. Ano ka sa CC?
Naman. Preservative, anticoagulant. Preservative. Diba? What's the mode of action ganit ka sa sodium fluoride?
Ay, sa itong glide.
Kasi
Glucose?
glycolysis. What specific enzyme sa glycolysis ang inhibit sa iyong sodium fluoride?
First letter daw, sir.
It inhibit your enolase.
Ornolase. CC1. Enolase. Ba si sir?
Dahil na sodium fluoride, it will inhibit enolase so that your bacterial class will not consume the glucose present on your sample. But you know, class, according kay Henry's 24th edition, sodium fluoride is not that effective anymore. Mas better mo gamit sodium citrate as well as EDTA to preserve your glucose. Tinood na sa Henry's, nabasa na ito na. I-highlight ko na sa book. That's why it's better class to use sodium citrate ng EDTA. But still, ginagamit niya pang karoon is still sodium fluoride. Okay? Paniha, sodium fluoride, it inhibits chemical tests for glucose, blood, and LP. So what if present class ang vitamin C or ascorbic acid? And then, if present in class, if your patient is taking this medication, it can cause false positive result. So the result, BB lang. Bilirubin, blood, leukocyte esterase, nitrite, glucose.
Bibilang.
And then, vitamin C or ascorbic acid can cause a false positive reaction on this chemical reagent parameter, BB lang. Blood, bilirubin, leukocyte esterase, nitrite, and glucose. Okay, so you need to add class appropriate preservatives. Unsa ganina mga substance or analyte na nag-decrease? What's our mnemonics for that kung mag-decrease? Diba? Pabaon. pH, bacteria over nitrite. Dahil pH will decrease, bacteria will increase. pH will increase, bacteria will increase, odor will increase, and nitrite will increase also.
Anong pH?
Yung pag-ulit preservative.
Bacteria. pH, bacteria.
May na mag-increase ang odor.
Odor. Nitrite.
Yeah, what's the action of bacteria? It will convert. What's the major organic substance present in the urine?
Nitrite.
Urea. So, yun, ang urea, ma-convert siya into ammonia by the enzyme urease. So, kanang mga PPMCTs ng mga bacteria, muna sila ang mga positive for urease test. So, pila sila na nag-convert sa urea to ammonia. Mga PPM cities, Providencia, Proteus, Magdalena, Manila.
Pobrina.
Kani, i-discuss pa na ko ni.
Ayaw
Atong
sir.
wala na discuss. Kani, first morning. This is utilized class to prevent false negative test for your pregnancy testing.
Pregnancy.
Kasi diba, beta human or unit gonadotropin or beta HCG is increased class on first morning specimen. And this is utilized class to detect or evaluate orthostatic proteinuria. What do you mean by orthostatic? Standing or postural or cadet or transient proteinuria. So how can you differentiate class orthostatic proteinuria from true proteinuria? Kaya ortho versus true proteinuria. Kasi true proteinuria class namin siya sakit. Okay? So you can differentiate this, for example, urinalysis at 5 p.m. Then urinalysis following day at 6 a.m. Okay? So since orthostatic proteinuria class is affected by posture, for example, ako nagatindog pa ron, increase ang pressure since I am standing. Expected class, if nag-prolong kag standing or nag-strenuous exercise ka, possible protein can pass through to your glomerulus. Okay? So if I'm going to class, undergo urinalysis at 5 p.m. after a long day of standing, what will happen to the result of my protein? Positive or negative?
Positive.
Kaya na protein is na class protein. And how about in true proteinuria? Nag-siya sakit sa kidney. Pag positive yung protein, negative. Positive. And the following day, nagpa-analysis ko, pero naka-rest na ko, nakahiga, nakatulog.
Mag-negative.
What will happen to my result of protein on the orthostatic proteinuria?
Negative.
Negative. Balik sa normal. How about if naka-true proteinuria?
Positive.
So, ma-differentiate sila class 2 protein.
Thrombin.
Tandaan na, sometimes we call this as cadet.
Kadet.
Pero mga cadets, masulat yun.
Katindog.
Or transient proteinuria. Do you know, class, there's a study conducted for those saints lady na sa Tindog. They're very prone to developing kidney diseases.
No, bawal di
Kaya mga cashier, wala yung mga chair, di ba? Tapos sa mga malls. Kasi all the time, nag-increase ang pressure sa allowance plus protein can readily pass through yun. That's why it is Tindog. For a long period of time, so liquid talaga sa. Okay? Next, to our postprandial. Siyempre kanit, very supportable. This is also correlated class with the normal blood glucose level. So usually in a performing class to detect, or to monitor effectivity of insulin therapy. Okay? We also have, this one class, paki-add, to our postprandial specimen. Mabalimit naman. To our postprandial specimen, is the specimen of choice class for what test? Aside from insulin therapy, you're going to say after eating.
After eating.
2 hours after eating. Okay? Sige, what's the normal pH ng insulin? Acidic, alkaline? Acidic ha? Pero do you know, class, that 2 hours after eating, maging alkaline ang idik. Yan naman. Ito yung tinatawag na alkaline type.
Alkaline time.
Alkaline type.
Ay, time.
That's a time class that our intestine, our stomach class is actively digesting the food. And di ba, usa na acid na present sa stomach? Hydrochloric acid. And during this time class, nag-digest ang natuang intestine, nagkaroon siya interaction class with your bicarbonate. Kasi bicarbonate, gusto sa tiyan, causing class maging alkaline na natuang tiyan while nag-digest ang food na to. Causing your urine class will be alkaline after 2 hours. That's why 2 hour postprandial specimen class is very ideal for urobilinogen testing. Ano naman? Kasi urobilinogen class is stable at alkaline pH. Okay? Take note of that. 2 hour postprandial for alkaline. For Urobilinogen testing. Next, for glucose tolerance specimens, usually used to diagnose GDM, gestational diabetes mellitus. But one of the main disadvantages ng ANI class is that your patient will stay for a longer period of time sa hospital. Now, for example, 3 hours kapag stay. Okay, so together with your blood sample class, mag-collect po ito urine. Okay, kasi you need to correlate if actively ba nag-filtrate, actively ba ma-reabsorb sa PCP ang glucose, kasi if not, there's a possible problem class. Okay? What's the glucose load ganyan na ginahatag na to for GDM?
75 grams.
75 grams dissolved in pinaka-distilled water. Pila ml? In 300 ml distilled water. Diba? Very small lang na siya class. Okay? So one of the most common problem po encounter with patients na mag-undergo aning test, suka, nag-vomit. Okay, and once your patient class will vomit, balik na po. So, how kung this mo sunod?
Dala lang.
Dili lang.
Hindi baka room dili.
Ano yung susunod na?
I mean, it's a common trend kung karoon ka sa mga age groups karon na na-realize na ito, na result in our life. So, most of us kayo, wala ito yung nag-meeting pa. You know na lang. O, you know na lang. Nag-get na lang. Okay, next. We have your 24 hours specimen or time specimen. Na-discuss naman sa lecture on pag-collect ani. But the patient should start with an empty bladder and end with an empty bladder also. Okay, kasi the main the main reason when you nag-false error accumulating ani because of volume. Kasi volume class kasi natin computation ani sa lecture yun di ba, to measure your glomerular condition in GFR 1.73 meters squared times volume.
Hindi daw mag...
Di ba mag-solving? Pero mag-solving. So, ako lecture, mag-solving. Di ba nag-nurse ako sa leg? Hindi mo may department na.
Salamat.
Okay? So aside from 24 hours specimen class, quantitative analysis, this is also used to measure GFR, glomerular filtration rate. Now, what's the analyte class pinadetect na to for GFR? Sa pinaka-most common analyte na pinadetect na to measure GFR? Creatinine. Number 2, sa
Inulin.
Cystatin C.
Cystatin C.
And beta 2, microglobulin. Pero among these 5, kinsa ang gold standard?
Inulin. Magbadam ka nasa sisi.
Nadaan ang mga analytes class na pwede detect using your glomerular filtration rate. Using your 24-hour time specimen. Next, we have your catheterized specimen. So this is the ideal specimen class for bacterial culture. Okay? But the main problem ng class or the main disadvantage of this, sabi na kami disadvantage ani. Kaya sakit siya sakit siya class pero naman siya lubricant. Pinapuntahan lubricant ang kanang Foley catheter before insert.
Ano dito gawin ano? Bet man yun.
Okay, what's the main disadvantage? Possible class, the patient will develop urinary tract infection. Ano man? Kasi di ba? Kasi na bacteria gani ang nag-form of biofilm as their virulence factor. Usually makita sa mga catheter tips.
Ay! Tulong ito, di ba sila? And
Common lang, common din. Sabi na focus,
first,
class, kita rin yun kamu nang ginakat, then ginasend sa bacteriology, okay, to be utilized class for bacteriological assay. Tama ba? Di ba kani? Yung mo nitong catheter
Kasi
tips.
Epidermidis.
So, muna yung agar, now, how you're going to inoculate your specimen class. So, for example, kung urine, kaya di ba ito ang i-strict man. So, pati yung nadawat ka ni catheter tips. Smear. We call this as, that's chapter 6 sa Bicol. Plus, kaya ginagawa na ko tinod din na kay, di ba, as a person, gusto mo nag-receive mo, di ba, we need receipt. Ito ginasulting. Okay na.
Naku, dulo
So, we call this as Mackerel technique. Mackerel.
Macaron.
Diba, naligid-ligid ang kaning siya using your forceps. Mackerel technique. Forceps. Okay. So, we have your, this is your Foley catheter. So, kita ninyo niyo, kanyang gina-insert glass, pero pag insert, wala pa yung balloon. So, kanyang balloon glass nas a fluid, usually NSS or distilled water. Pag na-insert na siya, yun naman ay magawas na urine, that means ano sa bladder. That's a time the nurses ang nag-perform ali, will inject here the fluid so that this area glass will form a bubble. That will indicate glass na malak. Malak siya din sa bladder. Okay? Then after naman catheterization, pwede naman i-aspirate ang fluid para maghuyos tong bubble na na-form so that ma-remove ang catheter. But again, main disadvantage, possible yung patient will develop UTI. Bila na pag in sterile condition ang environment. Okay, gusto mo yung catheter?
Wala, babae.
Okay, but this is very ideal specimen for bacterial culture. Next, we also have your mainstream clean catch. Diba, the disadvantage is less contaminated with epithelial cells and bacteria. So what the class with its statement? Ano need mag with the less contamination? Where specifically on your urinalysis na aspect class makakuha siya o problem? Sa microscopic pa rin. Same principle class. Kasi you know, famous epithelial cell are just like this. And take note class, that famous epithelial cell, we know is the largest sediment found in urine. Tandaan famous epithelial cell is the largest sediment found in the urine. That's why class, on scanner pa lang, makita na ni Monique. And this will indicate class, field of focus. Kasi you know class, it's very difficult to focus urine sample, lalo na sa inyo kasi urine is colorless. Unlike with a stool sample, you're in color background. But for this one, colorless ang ihi. Pag hindi mag-lisod, pangitaon na yun si epithelial cell. Kasi largest class. Scanner pa lang, makita na tayo siya. Okay? So, common problem, if it's field of view, syempre, ang RBC, gamay kayo, wala nag-midstream sa patient, patabunan si RBC. Pagkata mga small sediments causing false reporting class. You cannot interpret properly your sediments na ma-observe. Okay, sige lang, pag midterms hanggang finals, magsawa mo, magsigig, microscopy. Kailan na mo? Actually, ako isa dito sa midterm o finals. Kay hindi nga ako math activities. Hindi nga ako sa ko, samot lang sa inyo. Okay, next. Na-discuss mo sa lecture procedure, wala. Okay, so for females, so usually class in other countries, they are utilizing this tube, no? So this is the same tube glass inserted in the Foley catheter. Okay? This is done naman if the patient is not able to produce urine. Able to directly produce ang ihi kasi possible pregnant siya. Wala siya problem. Hindi po di-imagine. Okay, so after washing hands, remove the lid, then separate skin balls or the labia. Okay? But we cannot deny the fact na some mga hindi siya ma-follow. Kasi as a medtech, it's part of our job class to instruct your patient But still, nakarely hapon sa patient class on how they're going to collect properly their urine sample. And di ba, as what I have mentioned last time, when you instruct your patient class, take note, dapat wala kay language or dialect barrier. Kasi di ba, para sa tuwa mo yung sample, English ka dira, Tagalog, and your patient cannot understand you, it's useless. Okay? So, dapat mo ka nang namo sa same level of understanding. So, after that, cleanse from front to back using urinary opening with antiseptic towelette. Take note na that the wipes that should be used should be bacteriostatic lang. Hindi siya pwede bactericidal ha. What's the difference between bactericidal from bacteriostatic? Bactericidal will kill. Bacteriostatic will stop or prevent ang further growth sa bacteria. Okay? Then hold the skin folds apart and begin to void into the toilet. Okay? How do you collect baklas or urine? Pyramids and clean catch. I-void ang first part, then mag-stop, then collect the middle, then pag napulot na, stop na po, then urinate, or dire-diretso. Stop? Class, that's wrong. Kami now, that's wrong. For example, mo yung ihi. Okay? Kung mag-collect mo, alam mo sa inyong guts kung first portion na ba siya. Kung nasa middle portion, i-catch mo siya agad. Hindi siya stop class. That's why they have mainstream clean catch. You need to catch the middle portion of urine. Sir, mabuta nga ihi ako kamot. Hindi mo kaya ko nang ihi. So, okay lang.
Gistop tayo ninyo ka na. Tari mo.
Okay? Kaya ka sa mag-collect of urine. Dapat tuloy-tuloy ang ihi, then you catch the middle portion. Pag napuno na, stop, then continue voiding your last part of your urine sample. Okay, so finish voiding, cover the specimen with the lid. Then, label the container with name and time of collection. Importante nga yung class mga information.
Sir, na question, unsa do may tabo sir if i-stop tapos
I-stop class, possible makontaminate na po. Epithelial cells. Wala ka na po.
ay mo contaminate na ninyo.
Okay?
Diretso mo na po.
So, this is a illustration ng nasa medyo awkward yung position. Pero ano na kung ano kami mag-collect.
Sir, gunitan. Gunitan di ay.
Imagine mo lang.
Gunitan
This is the antiseptic towelette kanina. Ano ginagamit? Pamunas. No? Eliminate possible bacteria present sa skin ng your area. So, una rin proper illustration. This is a proper representation. Okay? Now, for the males naman, bugyo, bito ko yung anin.
Nitin mo kay nitin na. Ay.
Sa daw? Okay, sige next. For males naman, almost the same thing lang class, but they need to cleanse the tip of the penis with antiseptic towelette and let dry. But if patient class, if uncircumcised, that's a time to retract ang foreskin. Ano need bad class, i-cleanse ang tip of the penis if uncircumcised? Kasi if uncircumcised class, ang isang male, moist ang environment. Di ba? Pag moist ang environment, so double siya class for the growth of your bacteria. Okay, so somehow like that. Okay, sige next. So the same thing class, they avoid pa rin sa toilet. Makaling class, ganyan, statement. Do not touch the inside container or ano, commonly class may encounter niya siya is bata ang patient. Ilang kinasulod na ilang genital sa container. Okay, pero pag-adult naman, syempre na may sulod. So the same thing, finish pointing pa rin, then label the container with name and time of collecting. Okay, so that's how you collect no image sync in catch sample.
Sobrang ay, date sa ano.
Next, we have your suprapubic aspiration. So this is a traumatizing way of collecting urine. So imagine na directly punctured glass ang bladder. But we're not worried kasi now may this is assisted glass with ultrasound man to make sure na bladder ko na matusok. Okay? So this is a gold standard class na urine sample for bacterial culture.
Tama ako sa quiz.
Kasi less contamination. Kasi imagine, directly
Direct.
puncture. Then aspirate the urine, then collect the ball. Usually physician ka-perform ay class delicate. Usually class gauge 20 or 21. Pwede 21 lang. Ayaw po itong tapo kayo. Itong blood donation. Ayaw.
Matay ko.
Bilang gauge sa blood donation? 16. Transfusion?
18.
Wala ito? Blood donation is
18.
16. Pag-transfuse na
18.
18 na sila, dito pwede pareho. Mas smaller class kasi hindi pwede na dire-diretso ang flow sa blood. Kasi magkaroon o trolley or tapo ang patient. Okay, next, prostatitis specimen or feed-glass collection. So this is used naman class to diagnose prostatitis or prostate infection. So when we say prostate infection, that means this is a sample glass for males only. Na may prostate na babae? Wala. Okay? So this is a feed-glass collection. Ano?
Tanggalin mo to.
So we call this class as feed-glass collection kasi you have your three containers.
Sapit yan? Sapit yan?
Asa na? Sa tintin.
Okay, so we have three containers here.
Recto?
Lalaki man na.
Okay, so the first portion class, on this collection, wala talaga midstream, and wala talaga void. Kasi always class, parang yung specimen, ina-include. So this is the first portion. This is the midstream. Then this is the last portion. Okay? For example, nakakolect na si patient ang first portion. Then, midstream na po. Pag before class ang last portion, mag-halt o mag-stop si patient o healing. Kasi pinamassage ang prostate. Saan pag-massage? Kaya na station. Pina-insert, nag-gloves ang physician, nagamit ng lubricant, pina-insert sa anal, then pinamassage ang prostate. Okay? Kaya ginamassage man to release prostate secretion. That's why, on the last portion class, urine plus prostate secretion. Hindi urine lang siya ng first portion, urine lang po siya ng midstream portion, but on the last portion, urine siya with a prostate secretion kasi ginamassage class. Okay? Now, how the physician class will know if the patient has prostate infection? So, ginagamitan niya siya class on chemical examination. Chemical as well as physical, as well as microscopic examination. Since UTI man and prostate infection ang pinapangita, dapat tayo ma-observe na bacteria. Ba? Infection man? Yes. May bacteria. And usually, we report bacteria qualitative, rare, few, moderate, many. So, let's just say the reporting is few lang. Ano na first? Then, may presence of mast cell or WBC. Since infection man na
Yes.
Let's just say naalam siya sa 5 to 10 per high power field. So, mali bang result ka on your first container. Now, on the midstream catch, Dapat tayo ma-observe na bacteria. Dapat ma-observe na past cells.
Yes.
Dapat wala.
Ay.
Ano man. Kasi class, the midstream portion is your control. Control for bladder infection, control for prostate infection. So if you can observe class, bacteria and past cells, that means invalid at testing. Tandaan ha, if tayo ma-observe bacteria and past cell on the midstream portion, invalid ang result kasi control siya for bladder infection and prostate infection. Okay? Now, on the last portion naman, na may bacteria present, naa. Na may past cell present, naa. Let's just say, ang reporting sa bacteria is many na. Then, ang past cell ni mo, naana siya sa 20 to 30 past cells per high power field. So, if this is your result, na may prostate infection si patient, ano man?
Taas.
So, always class, tandaan yung value ha. Dapat always mas daghan ang numbers sa WBC and bacteria sa container number 3 para na prostate infection si patient. Kasi nga di ba, mixture of urine and prostate secretion. But if ang container number 3 is mas lesser iyang bacteria and past cells, that means class, wala nag-contribute ang prostate secretion to the number of bacteria and WBCs. That means your patient has UTI, upper lower. Bladder infection, upper lower. Lower. What's the medical term for lower infection? Cystitis, pyelonephritis. Cystitis. Kasi pag pyelonephritis, upper. Okay, so that means your patient has cystitis. Okay, kasi na-WBC, na-bacteria, pero coming from the urine, not from the prostate secretion. Okay, or ang value niya is almost the same thing with container number 3 and container number 1, approximately equal to. That means UTI hapon si patient. Nakapalo. So, muna 3-class collection for prostate infection. May ginatawag na prostatitis especially. Sarap na sabdan na.
Yes, sir.
Okay. So, ano ganing na result class, UTI, 3 is less than 1. Kasi, what does it mean? If 3 is less than 1, that means that the origin of bacteria and WBC is coming from the bladder or salivating. Kasi if nag-increase na siya class, the number of bacteria niya and your WBC, that means gikan sa prostate secretions. But since lower man or equal lang iyang value, gikan lang sa okay. Mapalaw. Now, can you differentiate upper and lower UTI based on urinalysis?
Yes.
Yes or no? Siyempre ka sa visual now, kaya result mo on your microscopic examination will always be correlated class with your chemical exam. So, dapat mag-positive, since may bacteria, mag-positive si nitrite. All the time ba na mag-positive si nitrite in the UTI? Remember na ang nitrate, ang nitrite reductase test. For example, nitrite negative. Does that mean that the bacteria wala siyang nitrite reductase na enzyme para ma-convert, nitrate reductase para ma-convert si nitrate to nitrite? Pwede class. So, kasi possible na further convert si nitrite into nitrogen gas. Kasi ang bacteria na siya yung nitrite reductase na po. It doesn't mean na nag-negative sa nitrite, automatically negative. Kasi possible na bypass ang result. Okay? Dapat mag-positive po si LE. Leukocyte esterase. Dahil na LE, pag mag-positive na ay UTI. Sir, what if ako nakita WBC? Hindi ni patient. Pero negative lagi ako ang LE. Kasi meaning ano? Pero na po isa, sir, na sa kainit, kita ko WBC, pero nag-positive ang LE. What does it mean? Ano na result? Leukocyte esterase, which means we are detecting the enzyme esterase. Kinsa lang ba ng mga WBCs ang esterase? Those granulocytes. Because esterase can be found on their granules. Primary, secondary, tertiary. Primary granules makita ang esterase. That's why, class, if not negative, ang leukocyte esterase, that means dili, granulocyte ang present. Possible, leukocyte. Paano? Unang reason, kung mag-negative ang LE, pwede na po hindi sino-observe kasi positive ang patient na ay viral infection. Okay, now let's go back to that question. Can you differentiate cystitis from pyelonephritis? Lower, upper? Ma-absorb pa ninyo? Wala may choice. Cystitis is lower. Pyelo naman is upper. Differentiate ba through analysis? Yes, kaayo class. Through microscopic exam.
True.
Kasi if you have cystitis, which means as an infection, lower sa bladder lang na to. Okay, so if bladder infection, you can observe the presence of bacteria. You can observe the presence of WBCs or mast cells. But if you have pyelonephritis, you can observe bacteria, mast cells, and cast. Kailan mo cast? So, this is your tubules. Example, muna mo ang proximal convoluted tubules. Minaw. So, ang cast, iyang shape plus sausage shape made up of protein. Makita niyo siya if you have kidney problems. So, anong sausage shape siya? Kasi na-form siya sa tubules. That's why, ang patient na pyelonephritis, upper UTI, that means sa nephron ang problema, makita dito ang cast. That's why you can differentiate upper or lower UTI based on microscopic exam. Hilo.
Yes, sir.
Nephron ang origin ka. Kasi diba, pag pyelonephritis, ang damage sa ureters and kidneys. Sa kidneys, sa nephrons.
Nephron.
Nag-make sense sa inyo yung UBF?
Yes.
Kasi slowly class.
I-combine niya tanan.
Kasi class ka ng 10 parameters, physical, microscopic, connected, di na sila tanan. Pag nalay isang na mag-lahit din na yung diagnosis. So, midterms, expect mo class sana, ang exam niyo sa lab kay results lang. Then, you interpret the disease based on the results given. Kailangan, I will teach you man kaya, ginahinay ko kayo yung discuss. Para asa sila, kung sila mag-positive, kung sila mag-negative. Kasi all of that class are correlated. Okay, so watch for prostatitis specimen. Now, we also have pre and post massage. Almost the same principle, class. It just happened na before mag-first collection, i-massage na. So that means ikaduha i-massage. Pre and post massage. Okay? So the same result, class, dapat mas daghan ang WBC and bacteria C, container 3 compared with container 1. Class, decision na nag-massage ng body, hindi kita may detect na nag-massage. Unless gusto mo.
Nabala kasi.
We burn.
Okay, questions? Last na to. Actually, nasa lecture na pa yung sa STEMI mirrors. Pero naman ang STEMI mirrors. Or mirrors STEMI. Ay, punto. May pangutan niya. Ha? O, muna ang discuss kanina, outdoor o kami. May mga substance na mag-decrease naman. Clarity, glucose, trichomonas. So take note sa Minaw on this changes in preserving in kanina trichomonas. So Ivaj, di ba na yun?
Yes.
The main identification factor class for you to report trichomonas is the motility. You cannot report Ivaj if unmotile siya. Ano naman? Because dead trichomonas class may be mistaken as WBCs. Karawang ginagawa sa WBCs. That's why crucial pag mag-report, dapat motility yun. So ganun motility? Jerky. Banana, jerky, motility. Georgia is olive. How about shooting star? Shooting star. Ano ba? Si Vibrio. Tingnan na natin. Tumbling. Hysteria. Cytosis. Okay, ayun na.
Sir, mo na to, sir.
Ha? Manata, ayun na pilang ubag. Ano na balik-balik ka na. Meet pataklas dapat ay isa ka meeting. Ay dapat ay 2 meetings. Ay mag-meet Sunday. So, ito ha, we still have 2 meetings left. The next meeting, magdala niya kung bilin sample. Kasi mag-analysis ka punta. Kung doon na yung utang sa kuha, doon ka-defense yung utang. So, lahat na po itong question for next meeting dapat. When nag-class, pinalilita mo kasi always yun, pag perform mo analysis, lagi may corresponding questions para at least yung binabuhat ka mo, alam mo nag-perform. Just for, just for formality. Sa dapat mo siya hindi na-perform. Same case? Same sheet ka, ano yung class? Break naman nung kanto. Di ba half lang to?
Yes.
Half lang yung gamiton. Okay? Then, maminaw, we still have, one topic left. Pato mga obsolete test class, urinometer, oscillation, densitometer. So, i-discuss pa na ako ito siya tanan. Then, natin calculation ha, so, meet the prelims. Mag-calculate na ako mga errors sa protein, glucose, sa temperature. No need the calculator. -1, -2 lang pinta siya. Hindi na pala sa inyong more value na dilution. Okay, questions? See, may question. Okay, doon na next meeting. For a case study. Okay, so for next meeting, mag-quiz na chapter 5. Renzel. Physical examination of grade. Fifth.
Chapter 5.
Ha? Pag wala sa physical lang, chapter 5.